Sasini mkofiti, welcome to Cele's Reflection. Manze nimewa miss, manze nimewa hata, yani let me tell you that 1 week nasikianga ni kama sijui ni nini. Anyway, karibuni sana. And today, for the past few episodes, or rather for the last few months, tumekuwa tukiongelea about mental health. Ni kama nimekuwa hata mimi na champion mental health, which is a good thing. Now today we are talking about something. It's the first time I'm hearing about it. I am happy Helen ako hapa. Juu mimi sijaisikia hiyo. It's my first time. Talking about mental health in pregnancy. Pre, during and after. Karibu sana Helen.
Asante sana. Thank you for having me today. My name is Helen Otieno. I am a nurse-midwife by profession. Currently working with Malaika, basically majoring on pregnancy journey, taking care of pregnant moms during the pregnancy and after the pregnancy. And I dwell so much into mental health. This is something that we've been missing. This is something that most of us don't take it as a normal thing. Just the same way unaweza pata flu ama malaria and you go to the hospital, it is the same way we are supposed to treat mental health. So during pregnancy, there are so many things, there are so many changes that happens to moms that I would say we ignore, or sometimes we don't take them seriously.
Or we
don't know. And all these things may lead to moms losing it. Like basically, most of us lose it. That's why we are here today.
Thank you so much, Helen. Aki, by the way, this one is, I think mental health is a good nini. Like, it's good to be, like, to talk about it because it's happening in our society. But this one, in pregnancy, now you have a special place in my heart. Wajua tunasemanga venye, ukiwa na mimba ni kama hauko sawa akili. It's like you're not 100%. You don't know what is happening with your body.
True.
So finding a place, a person that you can, and in this case you've said you're a midwife.
Yeah.
So finding that person like you, who you can talk to about how you're feeling, about ama akueleze why you're feeling like this, is such a good thing.
Yeah, like, thank you.
Yeah.
And so we are going to talk about mental well-being for moms during pregnancy and even after. And we are going to see what the difference is by having an anxiety and when we cannot call it now, we are getting into depression. Yeah.
Oh, so before we get into the postpartum, like depression, pale kwenye wasi usema, mimi nilikuwa na PP. There's the
PPD.
PPD.
Yeah.
There's the anxiety part because inaanza kama anxiety.
Yeah, it starts as an anxiety, and basically it's about having negative emotional changes during pregnancy. And these emotional changes, emotional changes most of the time, you'll find that there are those who will be able to cope with them and there are those who will not be able to cope with them. And as a matter of fact, you will find that there are those who cope within 2 weeks, and that's where now the anxiety comes in. So when someone is able to cope within the 2 weeks, then we call it an anxiety. Basically, you cope without major, I would say major, you don't use drugs.
What are some of these changes?
Yeah, most of the emotional changes that happens, you see during pregnancy, there are so many changes in your body. You are a mother, I'm a mother. So during pregnancy, one of the things is you have physical changes. So physical changes basically is mwili vile ina change. Yeah, your tummy grows. Basically, especially if you are first time mom, you are worried about what people think about you. And sometimes you'll find that the emotional changes will lead into depression. So the first thing that happens is some of the people become hopeless. Someone is just, they're just worried about what will happen to them, even during the pregnancies. Most of the time you'll find that there are those moms who have maybe a history of mental illness. And most of the moms with such histories, most of them will end up having maybe anxiety or postpartum depression if they are not taken care of, or if they don't get enough support. some people have the changes in thinking. So thinking means every time I sit down or every time I feel the changes that happens to me, I'm just worried. Like, I feel like, what am I? Is this baby okay? Am I going to make it? Will I be able to give birth normally? Those things.
Yeah, so like some of the things najua I can say personally nilikuwa na ile worry ya I'm getting another with my second baby. The first one nilikuwa excited because you're married, so we are expecting you to get, but with the second one mtoto wa pili nitatoboa watoto wawili. Unajua sasa vitu zinakuwa times 2 now. These are 2 babies, not 1. Then there's also the change for my second baby. Kidogo ni kama uso ilikuwa inataka, so pia unasumbuka what is happening on my so you worry about a lot. There's your body, there's the baby, there's your career, there's your life.
Yeah, and I can even talk about those people who get pregnant at a young age. Maybe they don't have enough support, and in mental health, support is the biggest thing. Like most of the time, if you get someone who will never get into a postpartum depression, they always have the best support.
True.
Support can be your mom, family members basically. Support can be your husband, but those people who get pregnant at an early age, those people who don't have enough financial support, those people they're at risk of getting into depression. Those people who have histories of maybe they had miscarriages before, maybe they've lost a baby before, most of them always get into postpartum anxiety, which may also lead into depression. Yeah.
So it starts as anxiety before getting into depression.
Yes. So it starts as an anxiety, and the anxiety has to be taken care of, because once the anxiety goes beyond 2 weeks, then we are now getting into depression.
So some of the things now that you guys take care of those mental health. Now this lady, I may come, I am pregnant. It's my first time being pregnant. I am having all these thoughts. Najiuliza, what if? So now I am here. What are the things now you start? Mental health. Okay,
so for all these moms who come while pregnant, let's say you come and you're pregnant, we do screening. This is something that we do, and it's supposed to be done every time, the same way ulikuwa unaenda your clinic visits. So the clinic, there are questions that you are asked, but you'll never know whether the mental well-being is being assessed. Yeah, so kuna maswali tu utaulizwa.
Maswali za clinic.
You call them maswali za clinic. But during those questions, we really assess your mental well-being. So when we ask those questions, we are able to gauge. Currently, there's something we are using, it's called an Edinburgh tool. That tool helps us to gauge your mental well-being. So when you feel, it's just common questions, like, have you ever felt like you are not a worthy person? Those things, those are the things we ask, and now we come up with a score, and this score will tell us whether you are almost getting into depression or whether you are into depression. We always advise you to get enough support. Like, let's say during pregnancy, because this is where it's the beginning of all these things. So we really advise that you get enough support during pregnancy. Support can not only be your family, you can also join groups of moms. Nowadays we have groups that maybe you have moms delivering in a certain month. You have emotional support from such people. When you discuss things that you are going through, then you see there's another mom who is even going through things that are worse than what you are going through. Then you'll say, oh, kumbe mimi afadhali. So the support groups really help. We encourage moms to do a lot of exercise. Take care of yourself. There are those who don't even care. Once they are pregnant, they feel, sasa mimi nisha. They don't even self-care. They neglect self-care.
But they get tired.
Hizi vitu ndogo ndogo kama kwenda manicure, pedicure, those things. Just make sure you breathe, like have a breath of air outside. Don't keep yourself. Like every time you keep limiting yourself, you have a lot of things in your brain and you start thinking a lot about what's happening to you. And pregnancy is something that we should embrace. sometimes the people who may get unplanned pregnancy may have a lot of problems, but we really encourage people to embrace pregnancy. And once you embrace pregnancy, then you will take care of your mental health.
I love that you've mentioned about taking care of yourselves.
Yeah.
Toka nje, just get a breath of fresh air.
Yes.
Some of the things you can do, like a pregnant woman can do to prevent this mental health, to prevent postpartum depression. What are those some of the... Umesema vitu ndogo ndogo. Unajua inakaa vitu ndogo ndogo, lakini kuna msee ajui kitu hata moja. What are some of those things?
Vitu ndogo ndogo, what I mean by vitu ndogo ndogo are, the first thing I talked about, having a support group. Like, siku hizi tuko na WhatsApp community, those things, so that when Cele shares her experience, I also share my experience, another person shares, and then we start seeing that this is something that is normal, this is something that we should embrace. So that is the first thing that we should do. When I talk about self-care, there are people who can't manage going for these other things like manicure or pedicure, but you can have time with your friends. Go out, make sure you don't keep yourself sitting down and thinking about your pregnancy every other time. Make sure you engage yourself. There are those people who are unable to work during pregnancy, but you have friends. So you can always organize to have free time with friends. Make sure you have, if you have friends who are working in a hospital environment, nowadays even in Facebook or Instagram, you can find people really talking about what they are going through during pregnancy. Such things will really help you to take care of your mental health. Yeah.
Now you've gone through the journey, 9 months, you've taken care of yourself. Basa kuna hii kazi inakujanga mtoto akifika.
Yes.
Unajua ball ni rahisi, okay, si rahisi, sorry, but unajua ball ni wewe tu bado.
Yes.
I'll move here, whatever I eat, labda atapike, but unajua sasa kuna haka katoto kamekuja.
Sasa let's say we already dealt with the antepartum anxiety. We are doing well. Most of the time there are people who will get a later anxiety towards delivery, because now will I really be able to push this baby out? Or even if I'm going for a cesarean, will I be able to come out of that theater? So there are symptoms that come later in pregnancy, and most of the time after 28 weeks. So we do another screening towards delivery, because this will also show us whatever will happen after delivery. Because if you have a bad experience just before delivery, and remember during the first few weeks, unajua hii maneno ya sleepless nights, you don't even know whether you are supposed to change a diaper or breastfeed.
Wanasemanga motherhood is the only nini where the sick person takes care of the unlike the other diseases, wewe ndo mgonjwa ndo sasa hiyo healing.
Wewe ndo mgonjwa and you are taking care of someone who is not sick. Exactly. Yes. So there are a lot of challenges after delivery, and that's why we do a screening just before delivery, so that even when we get into post delivery, then we are able to gauge where we are. So the first thing is moms get overwhelmed.
Oh yes.
Like, nitafanya nini? Analia nini? What is happening? You don't understand what the baby wants. You don't even understand what you yourself is going through. And so most of the time you will find moms feeling, I am worthless. I do not need this baby. I'm not doing a good job. I am not getting it. So most moms will get into postpartum depression, and now this is after delivery. And we divide this into 3. We call it postpartum blues. Postpartum blues ni zile zinakuja maybe between day 2 to 4, which is normal. Even if you don't get into depression, you'll always get postpartum blues. So what I mean is, in the 2 to 4 days, a mom will feel hizo vitu nasema worthless. I'm not doing a good job. I know. I know.
The first 1 week.
Yeah. So during your time kuna hiyo anxiety, and it has that name, postpartum blues, and this is normal. So within 2 weeks ufai kukua na hizo postpartum blues. Like you're supposed to get them within 2 weeks.
So this feeling of sijalala hii wiki, kanalia sijui kanataka nini, sijui nimechange diaper a day like 12 times, juu kadogo kanachenjiwa kila saa. Hatueleanwi, hatusikizani. I don't know. So that one is normal for 2 weeks.
That one is normal, and it should be over within 2 weeks. So if it goes beyond 2 weeks, this is now we start talking about postpartum depression.
Oh, really?
So postpartum depression, we get into it between 2 to 8 weeks.
And you can have a very good journey. We do the screening before we confirm you're okay. Then you get into postpartum?
Yes.
Oh.
So it really depends on how you are going to cope with the anxiety that comes after delivery.
Okay.
So there are those who are able to cope well, and this is where now we call for support. And that's why I said having the best support system is the biggest thing in mental health in pregnancy and postpartum. Best support system can be even your mother. So if you are able to get that best support system, like you're saying you can change 12 diapers a day. If you do 6, another person does 6.
I get it. You won't get overwhelmed.
You won't get overwhelmed. When you feel sleepy, someone takes care of the baby. So it's all about support.
And it's the little things.
Yeah.
Kama kusaidia kuchangewa diaper.
Yes.
Hey, unaonanga ni kama amekufanyia muujiza.
Yes.
Like,
yes.
Mlete tu nikakuchangie usiamke. Yes. You will be like,
and then during the day, most of the time you find that babies are awake during the night. Yes. And they sleep during the day. So sometimes when they wake up during the day, you personally get overwhelmed because you want to rest. We didn't sleep throughout the night. So when you get someone who will help you take care of the baby during the day, then you get it. So that you also have enough rest. We also say that especially if you are able to, you see, sometimes when we have watoto wadogo, our newborns, we don't care about going even out. Like, utaki hata kutoka kwa ile mlango, you just want to.
Hata for months.
Yes. And that is the biggest risk. It's the biggest risk.
Society imetufunza ukizaa kaa kwa nyumba.
Hapana. We want to take care of our mental well-being. And we encourage moms to, hata kama mtoto wako 2 days, go for an hour. Walk around, even around where you stay, hapo kwa estate, walk around there. Take a breather, come back.
Hebu ongelesha huyo mama hapo. Hata kama mtoto wako 2, hebu rudia hiyo.
Take a breather. I'm talking about going out. Going out doesn't mean tuende dunda.
6 hours.
Yes. Just go for 1 hour. You can take an hour in a day. Go walk around, come back. Let someone take care of the baby. The fact that you are staying with the baby 24/7, you even don't want someone to change a diaper for you. You are overwhelming your brain. You are overwhelming yourself. And that's where we get into postpartum depression. Yeah.
I love that. Because aki tunasemanga, weka kwa nyumba. Do you know how it's just like doing the same thing over and over for weeks. Juu mtu utakaa naye for 3 months kabla urudi ofisi if you are working. So for weeks you're staring at the same thing. Si ati tunasema tupendi watoto wetu. Tunawapenda.
And you're doing the same thing. Ni breastfeed, change diaper, kulalisha. Breastfeed, change diaper, kulalisha. So take care of yourself.
Cut that
of
sequence.
Yes.
Toka tembea.
And
hata lia sana wanawa.
It really does a lot for your brain. And you will never, those people who take motherhood like just a normal thing. You know, people take motherhood like a special thing. No, motherhood it's a normal thing. However much we have someone who is new into the family, we get excited, yes, but please think about yourself. Think about your brain. Think about your future. There are those moms who, when we get into depression, sometimes it goes beyond, and we call it postpartum psychosis. This is now where it's beyond. This is where we now use medication to treat the psychosis. And most of the time we say, when someone gets into such, most of them would not want to be with the baby. They will see the baby as the cause of their problems.
This is after now the 8 weeks.
Yes.
So after the 2 weeks, is there any medication for that?
No.
So that is only...
It's basically counseling. It's mostly psychosocial support. So as long as you have a support system, you have someone who does counseling to you, then that's it. But if it gets beyond 8 weeks, now we are getting into psychosis. And most of these moms lose it. Some of them even throw away the babies. But we say that during this period, you're not supposed to keep the baby away from the mom. So however much anataka kumtupa, the support system will be there to be with her and the baby. Some of them even wander around, yani wanatembea tu, hawajui wanaenda wapi, mguu tupu. Now that is now an extreme of depression.
Because now the baby is around 3 months.
Yes. That's an extreme.
So now you get into medication.
Yeah, so that's where now we get into medication. Most of the time, these ones are not even managed by psychologists. Now this is where a psychiatrist comes in to take care of you. Yeah.
Wow, that's sad.
Yeah, so I think mental health is something that is ignored, but it's a big thing. And it's something that is normal. I'm happy since we started pushing for mental health, even in Malaika, it's something that is now being embraced. We are getting people opening up. We are getting people giving in to taking care of their mental well-being, which is something that is positive. And we want to really fight and fight and fight so that people take mental well-being in pregnancy as a normal thing. Because hata mimi, when I was pregnant, there are so many things that happened to me that I'm a nurse, yes, but tunasemanga mganga ajigangi. You even ask yourself, what are these things? Yeah, so we also still take care of our mental well-being.
Now, I know we've said, at your home toy for 1 hour, take care of yourself, Yeah. But now we have moms, due to one reason or another, atakwambia naacha na nani ana support. Ama hanaogopa, maybe experience ya kitambo aliacha something,
Happened.
So kuna huyo mama mwenye ako like, siwezi acha. Like, hey, mtoto wangu hapana, ni wangu. Venye tu umesema, kuna mtoto kuchenjiwa diaper, sio kupenda kwake, haezi taka. As much as wewe unaona bishti yako anaku overwhelmed, yeye anakushow I cannot. She wants, okay, maybe she feels like doing that's when I feel like I'm being a good mom. I'm being a good, I don't want to delegate, I don't want people to feel like, what can you tell that lady?
So most of these moms, remember when we were starting, I talked about moms who are at risk of getting into this postpartum anxiety and depression. And I talked about moms who have previous experiences, bad experiences. And that's where now starting care early will help these moms. Because if we are able to guide you onto your mental well-being throughout the pregnancy, then when we get into postpartum, it will be so easy. But if you are not able to take care of your mental health during pregnancy, then it means even after pregnancy, nikikwambia nataka kubaki na mtoto hautakubali. But when we really take good care of them during pregnancy, then it won't be a struggle after pregnancy.
I get it.
Yeah.
Because you've walked the journey, so
Yes.
she's quite doing well.
Yeah.
So this after the 8 weeks, we've gotten into psychosis. We are doing medication. Support pia imekam, trying to bring you back with the baby. Is there a period for that? So that one can go.
We say there are moms who go up to 1 year after the baby is a year. Most of the treatment should end by 6 months, but there are moms who have extreme symptoms. So when you work on extreme symptoms, they will have to be treated for up to 1 year. But you need extreme. That's now, there are rare cases.
So the most cases ziko hapa kwa PPD.
Most cases ziko hapa kwa anxiety and PPD. But if we are able to take care of anxiety within 2 weeks, we don't get into PPD. But we would say among the pregnant women, almost 70% always have postpartum depression and they don't know.
Unaenda hizo 8 weeks unatoka hata hujai jua.
Hujui.
That's why I meet with women and say, na mimi basi nilikuwa nayo.
Yes. So more than 50%, actually up to 70% experience postpartum depression, but they don't know, they don't realize.
It is overwhelming.
It is.
It's no joke.
I have taken care of one baby. I have taken care of twins. I have 3.
You have twins.
So I have 1 and I have 2. So I have both experiences. I would say the twins was better
Than 1 baby.
I think because 1 baby was my first pregnancy, and I was so overwhelmed. I didn't know, like the way I told you, being a nurse doesn't mean we don't go through these things. And sometimes you don't even know what to do for yourself, so you keep asking people. So I feel that during my time when I was taking care of my first baby, it was more overwhelming. But for the twins, I think I was really prepared, so I didn't feel it. Yeah,
That's true.
I didn't.
Also, I feel like I can say I have the same experience with you. I don't have twins, but with my first one, unajua how expect hii kazi yote ya mtoto akifika. You're heavy, all you want to do is download this baby.
Yes.
But kumbe huyo mtoto ukitoa, kazi inakuwa times 10.
Yes, plus you are from you didn't, it was just you,
It was just
and maybe
me.
your husband. It was now there's someone else.
Now you need to wash this minyonyiz.
Yes.
You need to, this baby needs to be clean.
You need to express.
Diaper kikaa nayo sana anashikwa sijui na rashes. Mara kuna eczema. By the overwhelming ndo kwa tu.
Yes.
The first thing.
And that overwhelming is what brings about the postpartum blues that are happening within 2 weeks.
Now I understand why people tell you, ukiongeza hata wengine, please add, if you can add more help, please add more help.
Yes.
You're doing it for your own good.
Yes.
Because kama huyu atakuja, huyu akikusaidia mtoto, huyu anashughulikia the big boy, if you can, for your own good.
It really takes care. And that's why tukianza I mentioned about mental well-being is about the support system. As long as uko na support system, you're done. And support system can be family and group. Those groups that siku hizi watu wana discuss. Someone can even tell you a clue of what you should do. Watu wanaambiana huko, take a breath, go walk. Wanaambiana kwa hizo magroups. So it really helps.
Because aki ukikeka peke yako, unafikirianga watoto hawachangwi. Until you meet someone huko nje na mtoi wa 2 days.
Unashangaa huyu anafanya nini hapa?
Si amefunikwa, si yako sawa. I love that. So our biggest take home today is support.
Support.
Just get support.
Get enough support. Get family support. Get fellow pregnant moms or moms who've delivered support. Support means join them in their small groups. Discuss these things. Don't keep them to yourself. Speak up. Once you are able to speak up, someone else will share the experience, and the people will see how to help you.
And I know maybe most of the ladies wataogopa kusaidiwa, wasiambu you're not a mom, you're not a good mom. You're afraid to tell someone nishikie nilale.
Yes. Because
you're not a good
So those people who start mentioning that I feel like I'm not a good mom, that one is a red flag for postpartum depression. I feel like I'm not doing what I'm supposed to do. I feel I'm not a good mom to this baby. That's a red flag.
Okay. Because that's mtu atasema tu nitakupea unichange diaper, useme nilikaa tu. Alizaa na hawezi change diaper.
Yes.
Wow. Thank you, Helen.
Thank you so much also for having me here.
Now they have realized that they need help. You can do it by yourself, but you need help.
You need help.
Atusemi you cannot.
You can do it.
You can do it. But let someone help you.
Help is very important. That is the biggest thing.
Yeah.
Yes.
You're sick, you're healing. You have this new baby. Akona vitu kama 100. Maybe there nafikiria sahi huyo mama akona mtoto wako less than a week nasikia kulia. Akijua ile kazi ukam na watoto. You even think that if I get a washing machine at is bado.
No.
Bado.
You need to go out there and breathe. Don't go with the baby, just go and breathe.
Because at the same time, unataka utengenezwe kama ni hot chocolate.
Yes.
So imagine being alone, Helen.
Yeah, you will make hot chocolate by yourself.
Soup.
Breastfeed. Chemsha supu.
We tafuta
Nini?
usaidizi.
Diapers, jui nini? Uoshe mtoto. Uoteshe jua. How many are they?
Imagine.
Those things, you cannot manage all these things.
There are so many.
You cannot. So get
so
support,
many.
get support, get support.
Yeah, and that's our key take home.
Yes, take home. Get support, speak up, talk to anyone. once you speak it out, help will really come.
And imagine whatever you're going through as a new mom, most of the women are going through that.
100% of moms are going through this. 100% of moms who deliver are going through this. But support system is what now differentiates this one. So the support system is able to tell us huyu anapata support mzuri, so she's not getting overwhelmed. Huyu hapati support ama huyu hataki kupewa support. Yeah.
Kwanza sana nafikiria kliniki ya 6 weeks. Kameenda, kamedungwa, kanalia, ulienda peke yako, haujalala usiku, akatalala usiku, ulibebana. It's not a bad thing, but please just get help. It's a lot.
Clinic, patia mtu mwingine mtoto abembeleze, walk out for an hour, come back.
Thank you, Helen.
Yeah.
They need help.
They need help. They really need help.
And now if they want to reach those support groups, because maybe you're more linked to these groups.
Yes.
Because if I'm a first-time mom, I mean, most of my friends maybe hawana watoto. Maybe I'm the first one in my group kupata mtoi. But maybe akikam kwako unazambia, hii group ni poa, hii group ni watu wanazaa this month, as you said.
Yes.
Awa wanazaa November, shikana na awa. Awa, how can they reach you, Helen? I know we shall write the details. Kwa caption, can you smile? I know we shall write the details.
I'm happy.
Yeah, but how can they? Because you're helping. I mean, mtu anasaidika. So, anaweza kufikia aje?
So, currently our organization has such groups, and the organization is called Malaika. So, you can go to the website, malaika.com, and you'll be able to be led through the website on how to reach us. Having the support groups is just one aspect of what we are providing. When you get to us, you will also get your personal nurse-midwife. You'll be able to attend our weekly webinars. The weekly webinars are led by different experts, not only in mental health, but we really focus on mental health. We also have classes for breastfeeding, the Lamaze classes for breastfeeding and preparation for delivery. So we really take care of mental health during all these sessions. Another thing that we offer, currently we are doing postpartum home visits. So if you get overwhelmed, you are not able to go somewhere else to seek help, then we are able to come to where you are and give the help that you need. Yeah, so malaika.com is the website.
Thank you so much, Helen.
Karibu.
Asante sana. Mpaka mnakuja kwa nyumba.
Imagine tunakuja kwa nyumba.
Ukisema utaki kumwacha na hauna mtu.
Usiseme hapo ati sikupata help. We will come. Just sit down. We will come.
Thank you so much.
Yeah.
Guys, you've heard it. If you know of someone who is expecting ama has a baby ama you see your friend, hii information inamsaidia sana, please refer them to Helen.
Yeah.
Watasaidika.
Yeah.
And thank you so much for sharing that with us.
Karibu sana.
We are going to take care of our mental well-being.
Yes, mental well-being is the biggest thing.
Yeah.
So lazima tukue sawa mentally. Yeah.
For these babies.
Yes, for these babies.
Yeah. Thank you, Helen.
Karibu sana.
Thank you so much, guys, for watching. Until next week, bye-bye.